making this video about mental health and pain, uh, bereavement, all sorts. Don't know why I'm making this video. I guess I don't really know. Guess I'm trying to reach out. I guess. Yeah, this is hard. Don't know what to talk about really. I'm struggling a lot at the moment. Been on medication for like 22 years. Antidepressants, 22 years. I've been off it about, I think it's like 71 days today. I've been off antidepressants once in my whole 22 years. So this is the second time, but the first time was on morphine for my back because I've got a serious back injury, which I can't do a lot. I literally can't do normal things like you can. You know, like do weights or lots of things. Just even doing your shopping, you know. Like, I know we're going through this at the moment. This stuff that's going on in the world. Thinking about others and what they're going through. But yeah, I can't lift my shopping and stuff. So I couldn't go to Co-op, and that's where I live. Like, so I couldn't go to, like, I don't know, carry 2 bags or whatever. Because it's too heavy, you know. Like, you've got to think about the weight and how much you can lift. Otherwise, I do my back in, and then I'm stuck in bed for about a week. It's good and bad, obviously. It's good and bad. I don't know really why I'm making this video. I guess just to get help. I guess struggling a lot, hell of a lot, especially this situation we're in. I feel really restricted, so it's even worse for me. Obviously, it's worse for you lot out there. So I'm reaching out to the doctors at the moment because I don't think they've got my diagnosis right. I've never thought they've got it right from day one, but then they keep getting it wrong and changing it and all that. So I don't know. Well, just thought I'd make this video and try and talk about my stuff, maybe. You know, medications I've been on and all that. I'm alright. It's just hay fever. I've got big time hay fever at the moment. Should take tablets for it, which help. They'll kick in a minute. Kick in a bit. I've only just taken them. Luckily, the actual hay fever tablets work well, but I don't know at the moment because of obviously it's hay fever pollen time, isn't it? So it's a lot stronger than, you know. My teeth are all messed up because of my health, because of mental health. When you got mental health, you don't care about yourself. Well, it depends really. It depends on the person really. It depends on all different. Some person might get on better, and some people might not get on better. So my teeth are all messed up, in agony, and they're gonna have to be taken out, I think. Well, not think, they will. And I've got phobia dentist as well. So it's like big time dentist, the phobia. Like I can't even walk in there. You know what I mean? And just gotta do it. So I've left it for years. And it got worse and worse and worse. And being on painkillers off and on. I've been off it. I just went back on it I was on it for about, let's say, 2 months, and then something happened. Something to do with my ex, which is really heartbreaking and stuff. Yeah, trying to think of things to say. Normally I'm quite chatty, like, not chatty, but like, just talk and talk and talk. I don't think I got my diagnosis right, I really don't. I'm diagnosed with, well, in the beginning, in '99, I was diagnosed with depression, and then so I didn't know what was going on because I've been through some horrific stuff. I'll go into that maybe if I do another video, and if you want to ask questions or whatever. Yeah. Sorry, my brain switches off due to whatever's going on in there. It switches off. Yeah. Okay. So yeah. So I've lost it again. Yeah. So diagnosed with depression. So in '99 I had a nervous breakdown, big time breakdown. I was in mental hospital for about 4 times in 1 year, I think I was in there. And then 2005 I went back in, and that was my last time. So I've not been in since, which is amazing. That's pretty good. To be honest, you have to be doing something to get yourself in, basically, nowadays. You used to be able to just admit yourself and that's it. You just phone and you're in. It don't work like that anymore. It's a different thing now. So I would be in now if it wasn't for that. I think I'd have rest or something. It's not a great place to be, but I've had good memories in there. Like, met loads of people, all walks of, we're all in the same, some's got schizophrenia, some got whatever they've got, depression, severe depression, bipolar, all sorts, But anyway, I was diagnosed with depression, and then I was diagnosed with a personality disorder, which I didn't know what it was. Didn't even know what personality disorder was then. Didn't even know what depression was then. I didn't even know what was going on really. So like, for a very, very, very long time, I wasn't even able to talk. I had trouble talking and stuff. And that's improved in a bit, but I'm very much a hermit in a way. Like, keep yourself to yourself. I think I've done that anyway, but like, because of like a trauma happened, I've been through a lot of traumas, but a big trauma happened when I was 19. It was horrible trauma, beaten up and stuff. Not a fault of my own or nothing, and it's upsetting. Still gets me now. Still, geezer that done it. Like, he's kind of in my head in a way. Can't explain it. So I need to use a tissue, but I'll do that after. Yeah. I'm sorry about the mess. Some flowers up there. It's just nice. Sorry, lose me train of thought. Yeah, like, bloody hell, brain. Yeah, so I was diagnosed with that, and then I fought hard and hard and hard, because, I damaged my back in 2007. Well, I damaged it in 2003-4. I got jumped by 10 people in the place where I'd lived. And one night, I got jumped. I was in the wrong place at the wrong time. Messed me up. Mess anyone up. Mess anyone up. Not even with mental health, you know what I mean? If you didn't even have mental health, it'll mess you up. You know, that'll mess you up, mate. But anyway. And then 2013, I actually got a diagnosis, like proper diagnosis. So I suffer with, that's what they tell me. I suffer with PTSD, of all the traumas I've been through, I guess. So I got PTSD, which I didn't know. I didn't know for years. So I've been bouncing off the walls, or just fighting with myself, and even taking it out on myself. You know what I mean? Punching walls and my whole flat. It's bad. Shouldn't have done that. Thank God I just paid it off, and wasn't a thing. I still shouldn't have done that, which I didn't. Write things down, that would help, wouldn't it? Do you know what I mean? Write things down, and then you know what to say then, don't you? I'll do that next time, maybe. If I do this again, I mean, this is kind of like, not cry for help, but like, I don't know, a friend does videos and kind of inspired me a little bit. I've wanted to do it for a long time, but not really had the guts, I guess, until now. So diagnosed in 2013 with PTSD. They said I didn't have depression anymore, but my diagnosis is called what they diagnosed me with personality disorder called dysemic. When I say that to people, they're like, "Well, what's that? Never heard of that." And so I had to do find out what that is, sort of roughly know what it is, kind of thing. I don't think I got that. I still think they got it wrong. So, because I didn't want to be on tablets anyway, because I didn't think they were working, and they were drugging me up. And when you've been on drugs, like medication that's meant to help, and I think you should take it. That's me. That's me. I'm not saying you shouldn't take it. That's me. That's how my brain works. But anyway, so my ex, I ain't really gonna say what happened, but she's not here, and I'm pretty upset about it. I won't with a like bit of, I didn't see her for 4 years, but it doesn't mean you don't care. And it's cut me up. So I came off medication because she couldn't get help. She was very, very ill. Probably more ill than I am. But I understood her in a way, but I wasn't in the right frame of mind with her. It's a shame. More to that. Maybe I'll talk about another day. Anyway, let's go into the track here, aren't I? So yeah, dysemic, that's what the personality dysemic, and PTSD. And I think they said I didn't have depression anymore. And also, in my diagnosis letter, they said medication isn't the answer for you. Like therapy is, basically. So I did therapy, I think it was last year I did it. I lose track of time. Especially when you've been on antidepressants or strong antidepressants and painkillers and whatever. Not like when she did what she did, kind of put things in perspective. And I didn't think at the time. I thought, right, coming off it, I'm not going to tell the doctor because they're just going to say, stay on it or whatever. but I had a bit of a breakdown because of because of the feelings I had and everything, or have now. And sorry, I might end it in a minute because just see if this works really, to see if it's a good thing to do. This is just reaching out really. It's just so I came off of tablets. Plus my brain switches off, probably due to being on or whatever I've got. You know what I mean? Whatever, maybe it's the PTSD, trauma. Who knows? So I have these times when I'm like, can be quite like, not happy, but like quiet a bit, and then I have these massive downs, completely downs. Like, oh, that's my phone. I've got to go. Right, thanks. Let me know what you think. Sorry about that. Right.